Hi, I'm Dr. Scout, and I'm from LGBT Health Link. Each week, in conjunction with the National LGBT Cancer Network, we bring you the top news stories for our community in health in 3 minutes or less. So let's get to it. Let's find out what's been happening in health in our world this week. First story, if you weren't in New Mexico this week, then you missed one of the biggest health events we've seen in quite a while. They convened almost 200 people from around the state to address a variety of health challenges and make plans to make them all better. Good job, New Mexico. We're proud of you. Next up, California leads us with 4 new laws that promote health in our population. They banned homosexual panic defenses in the courtroom. They've said that medical examiners must respect trans identities on death certificates. Police are no longer allowed to use condoms as justifications for arrest of sex workers or anybody else. And interestingly, every healthcare provider is now required to meet a certain minimum standard of LGBT cultural competency. I'd love to see that law replicated around the country. Next up, we know that poor people have worse health, and unfortunately, there's a lot of ways that discrimination create poverty in our communities. There's a new report by the Movement Advancement Project out illustrating the negative economic effects of anti-LGBT laws on our families and individuals. And then good job for the Williams Institute for jumping on the recent release of National Health Interview Survey data. They've already released 2 studies using those data to measure LGBT marriages and families, and compares them to measures of LGBT populations across several other studies. Next up, we're happy to see that the UN Human Rights Council has adopted a resolution against anti-LGBT violence and discrimination. Of course, it wasn't passed unanimously. Some of the usual suspects, of course, voted against it. We love to see studies about our elders, and there's 2 new ones this week. A new study by University of Minnesota researchers outlines health disparities common in older same-sex couples who live together, while NYU researchers published a study citing, unfortunately, the harm and neglect inflicted upon LGBT elders by their caregivers. In our last story this week, vaccines, not just for the kiddies anymore. New research shows that the HPV vaccine does have benefits to help prevent cancer for sexually active adult gay men, not just the youth that most of the efforts have been aimed at so far. That's it. Those are our stories for this week. Special thanks to our amazing researcher, Michael Baer. Thank you very much, and we'll see you next week, same time, same place, with more health updates.